We are going to pick up where we left off with starting with periodization. So this is the concept of using a training calendar for athletes, typically for competitive athletes, but these concepts can also be used when working with our patients. The idea of this is that we're looking to see, we want to build up the strength with our clients and starting smaller, maybe lower intensity, and then ramping up so that their peak performance would be for either their competition or game that they were looking for. The idea with this is just to understand what the concept of periodization is. In the textbook, it goes over microcycle, mesocycle, and macrocycle. I am not going to ask you the specifics about that, but I do want you to understand what the concept of periodization is and why we would use it. Here are just some samples of periodization models, and the traditional one would be just using a training cycle that would vary in intensity, ramping up for the activity. Again, these specific models I'm not going to ask you about. I just want you to understand the concepts of periodization. So now we're going to talk about the type of resistance exercises. So this is the type of resistance that we could be using for patients when strengthening, and we're going to talk about each one of these as we proceed through the slides. So manual resistance pretty much is what we talk about when we're doing our manual muscle testing. That's manual resistance. So that is you, the therapist, is providing the resistance for the patient in the strengthening program. Here are some advantages of manual resistance, and we're going to also talk about some disadvantages. The obvious disadvantage when looking at manual resistance is the amount of work that would have to be applied or performed from the therapist. So this is a lot more work on the therapist's part. And it's also difficult to quantify the manual resistance, and this is going to be very different from one clinician to another. So it's difficult to say that I provided the patient with 5 pounds of manual resistance. My 5 pounds of resistance is going to look different than someone else's. So there's a lot of inconsistency, so the reliability would be poor with a lot of variability. Okay, so if we were talking about manual resistance, there's a lot of considerations that you need to be aware of regarding how you're going to apply the resistance, how much force you would need, use your own body mechanics, and the difficult, or one of the most difficult parts is keeping the movement smooth. So if I was going to instruct Matthew to raise his arm up like this, come on down, and then I was going to try to do resistance, you can see how, go ahead and raise your arm up. My position is going to change with the amount of resistance that I'm giving. My body mechanics, go ahead and raise up, would be different, and it would be very difficult to apply the same amount of resistance throughout the full arc of movement from my body mechanics and to maintain consistent resistance. So that is one of the biggest challenges for applying manual resistance. When you're providing manual resistance, you also want to be sure that you are providing consistent cues and you're very specific about the outcome that you're looking for, and being sure that you're also giving your patient an opportunity to rest. So from the demonstration that I provided, you can see that there is some coordination that's involved with performing this. So you really need to practice. So I would suggest that over the course of the next week, find someone at home, a partner, that you can practice providing manual resistance for the upper extremity as well as the lower extremity, and notice how challenging it is to provide consistent resistance throughout the arc of movement, as well as protecting your own back. So be sure that you're aware of your own body mechanics. So some obvious advantages to mechanical resistance. So this is using anything other than the therapist's manual resistance. So this is using TheraBand, using free weights, ankle weights, body weight, anything that's going to be something outside of one individual providing the resistance. So obvious advantage would be that you are able to be consistent with the amount of resistance that you're providing, so you can have a good objective measure of how much resistance that you are providing and have that documented in your SOAP note. You can add some variety to exercise programs by offering mechanical resistance and by offering different types of mechanical resistance. So using a TheraBand or a free weight, sometimes that variety encourages better compliance for the patient. Some disadvantages to this. Depending on the type of resistance that you're using, not everyone has mechanical resistance available to them at home. If the patient is very weak, it's too big of a jump from gravity to a 5-pound resistance. So if the patient is very weak, it's really not appropriate. And also the resistance could be limited to what the manufacturer, so regarding the manufacturer's amounts, so like for TheraBand, it usually starts with the yellow to red to green to blue to black to silver, or silver and black. And it's difficult to quantify that amount of resistance, and you're also limited by what that resistance is. So you can't offer, it's difficult to add a red and a green together to provide a new resistance. You're limited by what's provided within the TheraBand itself. So now if we're looking at particular populations, so we're going to look at pediatrics and geriatrics. One of the biggest concern is regarding the epiphysis of the children's joints, so whether or not the growth plate is closed. Kids can fatigue differently than older adults or just older individuals. So sometimes, you definitely have an issue with boredom and staying engaged and using the right muscle groups that you're looking for with mechanical resistance. In the pediatric population, you still want to make sure that you're using proper warm-up and cool down. When you're looking at geriatric population or older adults, you do have to be aware of their own limitations. Take into consideration if they have any comorbidities, so any other disease processes that are going on at the same time. If they're a sedentary individual and now you're introducing resistance to them, you want to make sure that you're starting a little slower than you might consider for someone in their 30s or 40s. But you also need to provide this education to your geriatric patients or older patients about how important it is to stay consistent with an exercise program and a strength training program, because it does reduce the risk of falls. So what I'm going to have you do this week, after you're reading and listening to this PowerPoint, is that I would like for you to select an age group, either pediatrics or geriatrics. You're going to find a peer-reviewed article that's going to describe the considerations for resistance training in that age group, so either in pediatrics or geriatrics. And in the discussion group on our Blackboard site, I would like for you to post a link to the article and 3 takeaways. So there are some instructions within that discussion board, and I would like for you to have that completed by April 3rd. What's important for this assignment is you need to be sure that you're checking in on the discussion board so that you're not using the same article that one of your classmates may have already used. So you want to not have the same article appear more than once. So now when we're looking at general guidelines for resistance programming, these are some special considerations that you need to take into account when you're providing a resistance program for adults or any population. You want to make sure that you have a warm-up and a cool-down. So if you have been in a therapy clinic or in a gym, you're going to see that patients start out typically on a bike or an upper body ergometer or on the treadmill to get warmed up first, and then start with the exercises. So you don't want to have a patient just start with strengthening right when they come in from the waiting room. You want to make sure you give them an opportunity to warm up. Make sure that you also allow for time for break time so that they get rest in between sets and then rest in between exercise. So try not to throw too many exercises at them at once. Because we're sticking with strengthening, this is when we're looking at our lower reps with higher weight. So you want to make sure that if you're looking to create change, you have to take into account the overload principle. So if they're doing repetitions of 25 to 30 at once in one set, then you're looking at more endurance training versus strength training. Other precautions that you need to take into account is that you want to be sure that these exercises are not pain-free. Sorry about that. So you want to make sure that exercises are pain-free. So this is the make sure that you're not no pain, no gain. So we have talked about that a little bit, but these patients in therapy are recovering from an injury. So that pain could be indicative of perpetuating the tendinitis or inflammation that they have going on. If a patient has chronic pain, then we're going to talk about that a little differently in that we have to change their mindset on what that pain is. So we may encourage them to have a baseline of discomfort of maybe a 2 or 3 out of 10 and make sure that we're educating them not to go above a 3 to a 4 out of 10. So chronic pain and acute pain patients we're going to treat slightly differently when we're introducing exercise programs. So that's more FYI, not something that you really have to be able to articulate for an exam, but is just something to be aware of, that we treat acute pain and chronic pain differently when we're looking at resistance programs. Another thing that you need to be considerate of is that if the patient is on a lot of medications, that could influence their response to exercise. So if they're on beta blockers to manage their high blood pressure, their blood pressure may not respond the same way as someone who is not on medication would respond. So you want to make sure that you could use the rate of perceived exertion to see how they're feeling during exercises, because monitoring blood pressure may not be as reliable for these patients. You also want to be sure that you're instructing them to breathe during the exertion, because patients are trying to hold their breath because they feel like this is going to provide them an extra oomph with the exercise, but then could result in a Valsalva response, and you do not want to encourage that. If the patient starts showing some compensatory movements, so a lot of all over the place movements, they're using muscles that you're not looking to work, then you want to dial it back, bring the resistance back, and then provide appropriate cues so that they're training the right muscles that you're looking for.